pre-COVID rates. If you're here and you're thinking that you're not the kind of nurse who is going to be cleaning any patient because you're not into the dirty work, that's what nursing is all about. So be prepared and be mindful that a lot of your patients, you're going to have to do all of those hard labor. You're going to have to clean them up, and this minute they poop, 5 minutes later, if they're having those C. diff stool, you're going to have to go back in the room and clean them up again when you put on your blue gown and you put on your little face mask and your gloves and all of those things to go in the room. So if you're the kind of person who is looking for a job in nursing and you're thinking that these are things that you're not going to be tolerating, or these are things you're not going to be able to deal with as a nurse, then definitely nursing is not for you. Alright, so now we're having Nurses Week right now, and I just want to kind of talk a little bit about our wonderful nurses out there, because a lot of us, we say, yes, I am a nurse, but when we do show up to work, we don't act like we know what we're supposed to be doing, in the sense that we have a code and you're sitting down at the desk on your phone looking like you don't know what a code is, or you're not there to assist your colleagues during that time. If you're that kind of person, nursing is not for you. If you're the kind of person that every time the call bell ring and you don't go and answer the call bell because the call bell is not assigned to your patient, nursing is not for you. I'm not saying that you're supposed to answer every call bell, because honestly, you have some nurses who are just lazy and they will hear the call bells going off and they ain't answering none. They're not answering any. They will let the call bell annoy you for the entire 12-hour shift, and they know it's their patient and they are not answering. If you're that kind of nurse, nursing is not for you. You have some persons, when they do show up for work, they are expecting to be taking care of patients, but the patients are on their phone, on TikTok and on Instagram, Facebook, and everywhere else except in the rooms that they're assigned. If you're that kind of nurse, nursing is not for you. You have some nurses who are here for the money. Definitely, we're all here for the money in whatever profession you're in. But it's not like one time when we had a lot of nursing contracts out there and the pay was good, especially during COVID time, when you hear about people making $150 per hour, or you're getting some bonus that was never seen before in the entire time of nursing. It's not like that. So if you're there and you're thinking that, oh, you're here for the money, yeah, there's no money really right now in nursing, because COVID has already passed and gone and buried, and we're just back to pre-COVID rates. If you're here and you're thinking that you're not the kind of nurse who is going to be cleaning any patient because you're not into the dirty work, that's what nursing is all about. So be prepared and be mindful that a lot of your patients, you're going to have to do all of those hard labor. You're going to have to clean them up, and this minute they poop, 5 minutes later, if they're having those C. diff stool, you're going to have to go back in the room and clean them up again when you put on your blue gown and you put on your little face mask and your gloves and all of those things to go in the room. So if you're the kind of person who is looking for a job in nursing and you're thinking that these are things that you're not going to be tolerating, or these are things you're not going to be able to deal with as a nurse, then definitely nursing is not for you. You probably need to consider a different profession, because this is what nursing is all about. Nursing is all about teamwork. You have to be a team player. You have to be able to multitask. You have to be able to handle all different patients that come in front of you, whether or not they're slim, thick, or fat, or obese, let me just say, because I don't want to offend anybody, but depending on the size of the patient, you have to deal with them. You have to be a people person, and even if you're not a people person, you have to pretend as if you're a people person. So if you feel as though this is the job that doesn't have anything to do with anything like that, then I'm sorry. I'm so sorry to burst your bubble. If you're thinking about coming into the profession, would I say probably go and find a different profession to deal with, because this is what we have to deal with on a daily basis. this is what the nursing profession is all about. And to all of my wonderful nurses out there, I know this is Nurses Week and it might not come out in the time when, you know, it's Nurses Week. I definitely want to say big up to all the nurses who have been playing their part as team player. You know, they're playing their part as advocate, teachers. You know, they're playing their part as that wonderful caregiver for the patient. When you go there, you show up and you give your best, regardless of how tired you're feeling, how exhausted, how chaotic the environment is. You go out and you give your best. And I just want to say I am so proud to be a part of that group of nurses, because may I tell you, so when I go out there and see my patient, you know, I give my best even when them cuss me out. The only thing I don't tolerate with them is when they're, you know, very rude and disrespectful, because some of the patients, they do cuss you, you know, they do argue with you because they're confused, and we can't really ding them on that. But the ones that are gonna be arguing and cussing me out because of something else that is beyond my fault, you know, then definitely I don't tolerate that. I don't tolerate disrespect. So I'm not saying go out and tolerate disrespect from anybody. It depends on the situation. It depends on the mental status of the patient. And if you know that your patient has dementia, and if your patient have Alzheimer's, and your patient is confused, then definitely sometimes, you know, you just have to kind of sit behind, because there's so many things that are contributing to why that patient is acting like that. But anything else, I don't tolerate it, and I'm not expecting you to be tolerating it as a nurse. A lot of persons see us as professional, but I know sometimes, you know, things kind of go sideways, and you know, people just have the wrong impression about us. But definitely nursing is a wonderful profession, and if you have qualities of being a nurse, just go online and look it up. If you have good qualities of being a nurse, you know how to talk to people, you are a people person, you can multitask, you know, you love what you do, you love to save patients' life, then definitely I would say welcome to the profession of nursing. And I do hope that, you know, you will have a wonderful time here, have a wonderful time serving in the profession. All right, well, until then, I will see you in the next video, because I have a patient that I'm going to see. And oh, this train track, yeah, I have a patient that I'm gonna see in 2 minutes, so I am just heading over there, and then after this patient I will be done for the day. All right, why this road just seems like it is the wrong road I am on? Yes, I am on the right road. So I think I'm in the wrong lane, but yeah. All right, I will see you in the next video. Remember to like, share, and subscribe to the channel, and turn your notification bell on for more content related to nursing, travel, and lifestyle. I will see you then. All right.